I'm delighted to be here representing Northern Health, and I think this is such an important symbolic measure that Northern Health is actually presenting to this conference. The work I'm about to talk about today comes out of a bigger piece of work, and not strictly speaking research. We didn't get funding for it. We didn't have a research ethics review approval process. This was something we just did. And so I'd like to start with the thank yous to the gay men in our community and across the North who actually trusted me enough. And actually, I do think our ethics process was quite strong, and perhaps stronger than an institutional review process. The most important thing I think that I'm going to be doing today is actually complicating your picture of gay people who live in rural and remote communities. So I do have to, that you dance with the one who brung you, so I do have to tell you a little bit about Northern Health to start with. But I also want to really bring some of the voices of gay men into this room so you can hear what the experiences are like, and hopefully walk away with more respect for the courage and dignity and grace of men's lives and young men's lives in Northern BC. This book, she actually took on, I think, that notion, that Brokeback Mountain reality, the violence and that sad lives and desperate lives. And in fact, in the work on intersectionality yesterday, my good friend Travis and I were talking about why we were struggling with that, and we figured out it's because we live it. We might not have a name for it. And so I've asked Travis if he could actually say what he and I talked about at breakfast this morning. Travis.
Good morning. Ooh, that's really loud. Yeah, we talked about how the different levels of life that are all interconnected, and that being, for me, a gay man is not just an issue, but being a native is being an issue, and on top of that, being a gay native is an issue, and then on top of that, being in the gay world, a drag queen on top of that, and then so being interconnected on how the different positions you can be in, I guess, and that also allowing yourself, living in Prince George, that it's not something that you look at something like that as being positive or being fun or being, I don't know, it's Prince George. But you can see that in a big city compared to a small city, you have the luxury of choosing your friends in a big city and choosing the different groups of people you want to allocate yourself with. And in Prince George, you're kind of screwed and you're stuck with who you have that's out. So it's either me being a drag queen, being friends with this like crazy lesbian, or this like other different like bear person, and so you're stuck with the people that you have that are out in the community. So it's a range of the people, but it's one person from each group. It's not like a whole community of people. So that's the difference, where a smaller community makes you and forces you to be friends even if you don't want to be friends, because at the end you have to come together as a community to support yourself and to support each other. So,
thank you, Travis. Beautifully said. So what Travis said, I'm now going to say in more academic terms. But one of the things that I think is really important to recognize is that there's a triple jeopardy. We do know that men's health in general is poor, and we also know that men in Northern Health who live in the Northern Health region, their health is worse than men in the Lower Mainland. Well, if you add gay to that factor, to that equation, we're looking at a triple jeopardy. And that's sort of when we're talking about gay men's health, that I think is a crucial factor to consider. I want to say that I think Northern Health is an example that we are going to find allies in unexpected places. Those of us who are boomers in the audience, we're starting to get into positions of power. So look, for myself, being in Northern Health in a reasonably decent position of influence, there are many more like me, and I'm hoping we're going to see the other health authorities step up to the plate as well. Within Northern Health, we have this population health program. It started off with just one person. It's now grown. We actually have 4 distinct programs, and my position actually straddles the inside of Northern Health, educating practitioners, as well as working in community and very much taking the community-driven process. We don't go out and say you should all quit smoking. The theory that we work with is the iceberg. Some of you will have seen this before. What the tip of the iceberg is the things we tend to focus on, and so for gay men, that will be sexual health practice, using the condom. But the reality is that there are things beneath the surface that influence those choices, and these are the determinants of health. And so we argue that the further down the iceberg you go, the more complex the conditions get and the more invisible, and that we need to be addressing our health issues on this level. And we're waiting far too often until people show up in desperate need of care. The determinants of health from last year's report, these are Health Canada's determinants of health. I actually think that, first of all, gay men's health really is the canary in the coal mine when it comes to the determinants of health. Not only do we show what's missing, there's several important determinants that ought to be considered. There's also, they're presented here in the order in which they have the greatest impact. And I think for gay men, that order is different. It's not the same order of influence and impact that Health Canada has. This is the triple jeopardy for men's health in northern BC. The problem is we don't have enough doctors, so the luxury of having a doctor that you can be out to is problematic. This is my pride and joy at the moment. This came out yesterday, released at 10:30. We were hoping to have it released for International Men's Day on November the 19th. But it had to go through many stages of approval. We just got it out yesterday. And this is the work that I'm presenting on gay men's health. We have a chapter on it, but it's also embedded and addressed throughout the project as well. And the proceedings from last year is something that I consulted preparing for this as well, because I didn't want to come and just babble on about northern gay men's health. I wanted to make it relevant to the summit. And I think that we have a really strong gay community, as Travis pointed out. We don't always get along, but most of the time we really do have to, and we will come together because we're going to be a united front to the rest of our community. Population health, I know there's some difficulty for the determinants of health with gay men, but I think the thing that gets overlooked is that population health really does look to reduce inequities, and certainly within Northern Health, I get a place to stand that says gay men count. Aboriginal men count, single fathers count, the guys who don't make it into the mainstream. What's missing, I think, is the notion of sexuality and gender identity as a determinant of health. Those are hugely going to influence your capacity to have good health. And what I'm going to do is take each social determinant, and in the yellow is a quote from, we did focus groups and interviews, are quotes that I think illustrate the social determinant, or the determinant of health that we're talking about. And I am one of those people, I've got attention deficit disorder, so my slides are really busy and have lots on them. So I do understand that you will get access to these and be able to read it at your leisure. So really, this notion that I took my title from was the young man talking about the fact that with his doctor, he's doing these mental calculations about coming out and how he hasn't come out because he's afraid he's going to lose his doctor. And that would mean no care, because in Prince George, there's a significant majority of the population who have no doctor. Social support network, this is speaking to what Travis said, the idea that you have to create a space. And I know when we were having a big fight in our community about pride, one of the gay men saying, if all we have in common is the fact we have sex with the same sex people, then we have nothing in common because nobody in this room does it the same. So is that enough to bring us together? And necessity really is part of the invention of bridging differences. The other thing is that there is a hardship to living in Prince George, that homophobia sometimes hits you at the most unexpected times. You're not prepared for it, and that's hard to live with. Education and learning, we all know from the media coverage covering the gay youth suicides. Classrooms ought to be, they can never be safe, because you want students to take risk in order to learn, but the reality is they're dangerous, and that's not okay. And so working to actually see that our gay youth get the support they need to get their education. And Pride UMBC just won its center of its own after fighting for 8 years. This is one of the interviews who talked about his experiences in high school, and that they're torturous. And I have heard so many stories from young people who've survived high school in Prince George, and what's happening to our kids is not okay. And that's happening not just in rural and more remote communities. Employment and working conditions, what I have to say is the landscape of northern BC is what I would say is hyper-masculinized. So this notion of being a man really limits most men's access to healthcare services. They simply don't talk about their bodies, but it also creates added danger for gay men who are in these workplaces that are hyper-masculinized as well. As somebody said, you're going to go out and be in a bush camp for months on end. How could you possibly be out in those conditions? The social environment for gay men to find a place that's respectful in a society that does emphasize to a great extent a very traditional picture of manhood that's heterosexual. I mean, the very core of the definition of manhood being heterosexual. How does a gay man find a place then to find health services? Geography isn't counted in the determinants of health. I actually think this is another one. Geography does determine your access to healthcare services, your access to a positive role model and self-esteem and all of the things that contribute to gay men's health. So, for example, in Prince George, the size of the community, the bias slant that people have, the limited number of healthcare professionals, and also the levels of professionalism. You can't actually, we have some wonderful healthcare providers, don't get me wrong, but sometimes people are hired and they don't have the training and they don't have the wherewithal to understand, for example, confidentiality. So fear really does underride a lot of the interactions with healthcare systems for gay people in the North. There is really becoming your own advocate, becoming your own champion, figuring out for yourself how to survive. We have a really strong commitment to supporting each other, replacing family that's been lost. Healthy child development, we see how our young people are treated if they talk about being different. And so the attention to gay youth suicide isn't just something in the US. We lost a very delightful young man who came out in September and killed himself the week of his graduation. And he said that he could handle racism and discrimination. He'd handled that all his life, but he couldn't handle homophobia. And so, as one of my friends said, he buried his boyfriend one day and graduated the next. Biology and endowment, we have this determinant of health, I think, in the North is complicated by some very strong religious beliefs and the notion that it's just choice. It's a lifestyle choice and behavior, and you can pick to do something different. And how do we then respond to those kinds of religious-based belief systems in a way that in a small community you can't always afford to be out? And I know that around Pride we hear a lot from people who are angry that we do Pride because their life becomes a living hell in the coffee room in the days leading up and the weeks after. With the health services, what we were able to see is there's both the internal and external barriers to gay men accessing the healthcare services they need. you don't know, as this gentleman said, you don't know if there's a greater risk in not telling. I mean, maybe there's something that my sexuality, my sexual identity is going to matter to this healthcare issue, but you don't really know. And then, of course, there's the external stuff that happens in the society for men. And the carpenter's quote was really funny. He talked about, getting these deep cuts that he knew should have been sutured, but he knew he would get such a hard time on the job site. He didn't ever. And he says, my finger grew back, sort of, eventually. Gender, I think that's of such an important reason why this summit matters. There's such a paucity of research. Gay men's health equals HIV. There's very little work done on anything else. It really, every gay man is considered as a walking receptacle of HIV or a potential receptacle. And certainly the stories we've heard about gay men going to their doctors and everything then focusing around the HIV and the issues they came for, you have to say, excuse me, what does HIV have to do with this? I've got a sprained ankle. So that's certainly a problem. Building culture. In the lack of anything else, having to create your own culture in the North, finding a place to belong to, and as Travis says, we don't always get along, but we make the efforts. Overall, there is a very real fear, and what I want to say that I would really like, I know when I left Vancouver to move to Prince George, my friends and peers and colleagues were horrified. And what I've learned to come to terms with is the fact that there's real courage and real hope that I think is something for all of us. A big symbol is we've been celebrating Pride for 15 years next year. Will be 15 years of Pride. We even missed the 10th anniversary. And we make our own world, we make our own life in spite of all of the challenges. So my conclusions are that I think that speaking from Northern Health, we can't do this work alone. Health is not just about your body. And if we're only meeting you when you're 42 or 65 and you're coming in with complex conditions because we didn't work with you beforehand, that's sad. So Northern Health has very clearly stated that we will do this work in partnership. We recognize the myriad of factors that actually affect health and that really social justice is a determinant of health and that we want to work on issues that usually don't get addressed. That means actually we do have to share responsibility and accountability. But as we do that work, who are our best partners? And I think the real experts on gay men's health are gay men. And we need to find ways of having gay men's voices enter into the record. And certainly the work we did for this men's health report reflects that. Determinants are important, I think. I don't think we should abandon them, but I do think they're different and in a different order. And we do need to repeat to learn from the real experts, gay men themselves. Thank you.